Our lecture is comprehensive treatment for patients with adenomyosis with fertility needs. It's my great honor and privilege to meet my old friends and to meet new friends. So in today's lecture, my topic is comprehensive treatment for patients with adenomyosis with fertility needs. So I'd like to first review the mechanisms behind adenomyosis. According to the newest literature, adenomyosis is the tissue, endometrial tissue outside the uterine cavity. It's a complex syndrome. It is characterized by estrogen-dependent chronic inflammatory processes. It is more patient-oriented and considers the secular and molecular origin of the disease as well as the natural course of disease from adolescent onset to menopause. The characteristics of the complex chronic systematic diseases requires long-term treatment and management. There is no specific pathogenesis regarding this disease, and we should recognize it is an estrogen-dependent chronic process. And according to our research, menstruation is closely related to the development of endometriosis. Different secular and molecular abnormalities, including inflammatory responses and hormone reactivities, can affect the overall clinical presentation of endometriosis. And the endometrium of ectopic implantation is mainly composed of the stroma cells, and lack of progesterone receptors in endometrial stroma cells leads to the progesterone. And the endometriosis is closely related to clinical symptoms and fertility in terms of its severity. Most severe it is, the more severe results on fertility and pregnancy. Based on the classification, there are exterior or interior factors regarding the adenomyosis. Medication and surgery are the options. One thing I should point out is that for surgeries, laparoscopic surgery, this surgery is really challenging. I have conducted a lot of surgeries over the past decade. No matter how hard I work on to protect the endometrium, because the level and the diffusion of the lesion is out of control. And after the HIFU treatment, we do not recommend hysterectomy or surgeries for the patients. If the patient is with fertility requirement, do we need to pre-treat the disease? Do we need to ultrasound pre-treatment? For the large myoma, we recommend pre-treatment. So this requires the cooperation between gynecology, reproduction, and gestation departments. And for those patients who do not need the necessary treatment, so we should work together with the gynecology, reproduction, and gestation. And this is our center, the Minimally Invasive Surgery Center, Foshan First People Hospital. This center is a platform for surgery. We have a strong team. Chen Guoqiao, he is the director for our center. We have 7 doctors with qualification in gynecological departments. There are 4 physicians under training. In 2018, because the number of physicians is few, in 2021, when the center was established. Last year, we have conducted 420 patients, and this year we have 250 cases, and already we have a malignancy surgery treatment. The physician will update the report on the platform, and we will consult these cases online. If there is a difficulty, we can provide consultation on the platform. So one day before the surgery, we will have a specific doctor to review the report, point out the deficiencies in the treatment modality, and make some improvement for the modality or plan for the treatments. We have one JC200D and the JC300. This is a case I'd like to share with you. 34 years old, G3P1A1. The consultation first treatment time is May 27, 2027. 7 weeks of menopause, repeated vaginal bleeding for 10 days, with the requirements for fertility. And receiving the traditional Chinese medicine treatment with minimum feedback or efficacy. There is myoma and meiosis. 5 weeks after pregnancy, repeated vaginal bleeding was found. To June 10 to 28, we find that the enlargement of the adenomyosis and the recurrent vaginal bleeding with dull pain in the lower abdomen, vaginal ultrasound, intrauterine pregnancy 10 weeks, a single-leaf fetus, and the patient requires to terminate the pregnancy. After the miscarriage, we use a medication, and the bleeding is stopped. The diligence is used. We suggest the ultrasound HIFU for him. In 2023, we conducted HIFU for her. 30 minutes, 130 seconds for solidification, 400 watts. 10 seconds, there is a grayscale change after 10 seconds of ablation. So average power is 378 watts. 2 days after the surgery, the MRI shows that 95% of the ablation rate, and it's quite satisfactory of the surgery. 3 months after the surgery, we have provided the medication, and diligence was provided. 3 months in June, follow-up shows that the uterus volume is decreasing. There is 18 centimeters of lesion, of necrosis. And we will monitor the ovulation in the short term and guide pregnancy preparation for her. And the pregnancy preparation will not take long time to avoid the recurrence of the lesion. So we'd like to think about the following questions. So what kind of myoma requires or suitable for the HIFU treatment? Second, is a lesion pre-treated by medication more sensitive to energy? Diligence. Patients pre-treated by medication needs less sonication compared with those without pre-treatment of medication. For those patients with abortion history, or miscarriage treatment history, HIFU treatment will bring benefits for the immunity of this patient. For some patients with an IVT, they can have spontaneous pregnancy after HIFU treatment. So endometriosis is a complex syndrome characterized by estrogen-dependent chronic inflammatory process. In treatment of this disease, we should be more precise and individualized for those patients with fertility requirements. We should provide pre-treatment, bring more benefits. This is our hospital. This garden is the center of the city. So our hospital is located at the corner of the garden. So our hospital is the most beautiful hospitals in China. Welcome. Thank you.